Assalamu alaikum. I'm Dr. Sanamjad, and I'm here to discuss a very important module with you. And we have started already the anatomy module for MRCOG Part 1. And we have given 2 lectures before, and today is our 3rd lecture on anatomy. And it's a very big module, and you have to cover all these topics. So anybody was asking about the daily schedule as well, that what should be covering daily, because it is a very huge topic. So I have just listed down all the topics. What you have to do are these topics for the anatomy. Okay, so my first lecture was on abdominal wall, so anatomy of abdominal wall, posterior abdominal, anterior abdominal wall, and then the anatomy of pelvis and the perineum. Okay, then the genital organs, we have to discuss the vascular system, neuroanatomy, and endocrine anatomy. These 3 things only will be linked to just the obstetrics and gynecology. You don't need to discuss, you don't need to read all the vascular system, but everything related to abdominal and pelvic cavity. Okay, so the neuroanatomy discuss about the tracts and the plexuses, which will be related to obs and gynae, and then the endocrine, we have to discuss the anatomy of the hypothalamus and pituitary. These topics are actually small topics. So, and then the fetal skull, it's a very important topic for obstetrics and gynecology. Okay, so we are going to start our 3rd lecture today, and we were left with the perineum and few pelvic organs as well. So starting with our urinary tract, because it's also a very important topic for MRCOG. So actually you have to cover the basic anatomy of these organs as well. So kidneys, they have a major role in controlling the water and electrolyte balance within the body. They have a role in maintaining the acid-base balance of blood, and the waste product you all know is the urine. The important anatomical position, this is an exam question, that the right kidney lies slightly lower than the left kidney, approximately 1.26 centimeter. Why? Because of the large size of right lobe of liver. Okay, so this is an important anatomical location of right kidney. Right kidney will be slightly lower than the left kidney. Okay, so this is an important, you can say, the kidney is divided into the cortex. See, the outer is the cortex, inner would be the medulla, and there are the renal pyramids, which are the basic unit of kidney. And then this is the renal hilum. You all must have known that this is the renal hilum, and here the ureter starts. So renal hilum is actually very important for exam, because the hilum, it transmits from the front backwards few vessels and the ureter. Now the relation is very important, that what is anterior and what is posterior. So if you see from anterior to posterior, what is the most anterior structure is the vein. So first is the vein, then is the renal artery. Okay, there are the 2 branches of renal artery. Already a renal artery gave 2 branches, and they both branches enter the renal hilum. Then the ureter, VAU. Okay, and then also a 3rd renal artery as well, 3rd branch of renal artery as well. Okay, so this is the important relation you have to remember in the renal hilum. You must have listened to previous lecture of femoral triangle, where we discussed this structure. There in femoral triangle, the nerve and vessel structure was very important relation. So that was the lateral was the vein, and medial was the nerve. Okay, so now in this VAU, V is the vein, is the anterior most structure, then the artery, and then the ureter. Okay, so this is a very important structure for exam purpose as well. And then the lymph vessels, sympathetic fibers, they also pass through the hilum. Okay, now the coverings of kidney. There are the few coverings of kidney. The first covering is the fibrous capsule. So this surrounds the capsule kidney and is closely applied to its outer surface. Then after this capsule, it is a perirenal fat. It covers the capsule. Then this is the renal fascia. This fascia is important. So this is a condensation of connective tissue that lies outside the renal fat, and it encloses both the kidneys and suprarenal glands. Okay, this is an important structure, that renal fascia is covering both the kidneys and suprarenal glands. So it is continuous laterally with the fascia transversalis. And then after this fascia would be the pararenal fat. See, first was the perirenal fat and then the pararenal. So this lies external to the renal fascia. It is a large quantity. It forms part of the retroperitoneal fat. If you see this diagram, so this kidney, if you see, the outer layer is the capsule. Okay, so this is the capsule. First thing is the capsule, renal capsule, which is fibrous capsule. Then what's next? What next is this perirenal fat. See this yellow structure, it's a fatty structure. And then again, it's a fascia. So this is the renal fascia. And this fascia is covering both the kidneys and adrenal glands. And then another fat, pararenal fat. So 2 layers of fat, and you can say the 2 layers of fascia. Capsule is also a facial layer. So capsule, then perirenal fat, then renal fascia, and then also pararenal fat. Now, if you see the structure of kidney, the inner surface of inner medullary rays, you can say these are the inner surface, the medulla. These are the pyramids. Okay, so these are the pyramids. And then this is the hilum, and in hilum, see, the vein is anterior, and then there is artery, and then behind this artery will be the ureter. So this is the ureter, and ureter goes to the bladder. Okay, so move on to the next slide. It is important, the relations of kidney. So there are the anterior relations and the posterior relations of kidney, and the both kidneys have the few differences of the relations because of the abdominal organs. So if you see the right kidney, what is anterior to it? Actually, the suprarenal gland, also called the adrenal gland, it lies over the kidney. So it is present anteriorly. And right side, you have the liver. Then there's the second part of duodenum, and then there is a right colic flexure. Okay. So this is the anterior portion of the anterior relations of kidney, and posteriorly, where the kidney lies. Kidney lies on the posterior abdominal wall. So these will be the structures of abdominal wall. So what would be the structure? First would be the diaphragm and the 12th rib. This you have to remember, that this kidney is lying over the 12th rib. Okay. Then the muscles of posterior abdominal wall. So what are the muscles? The psoas, the quadratus lumborum, the transversus abdominis as well. Okay, because it is also the anterolateral muscle. So laterally it will be covering. Then the few nerves. See the subcostal nerve, the iliohypogastric and ilioinguinal. Because of 12th rib, you can remember that T12 and L1 would be there. Okay, so now what's the difference for in the left kidney? Left kidney, again the suprarenal gland would be present because it is located over the kidney. Okay, so these are the few organs which will be different from the right and from the left. The left side would be having the spleen, stomach, pancreas, and here was the right colic flexure. Now the left kidney, the left colic flexure, and the coils of jejunum. Okay. So again, the posterior wall, because this kidney lies on the posterior abdominal wall. So again, the diaphragm. Now, what's the difference? Difference is here, only here, 11th and 12th rib. We discussed previously that right kidney is approximately 1.26 centimeter lower than the left kidney. Okay, so it means the posteriorly only the 12th rib is present, but left kidney lies just above. So 11 and 12, both ribs will be present. Okay, different relation. Okay, so relations of these structures these organs, they are important for exam purposes. Can ask you relation. Okay. The exam aorta, interesting aorta, direct branch in the very, very. Hello. Okay. My is visible to all of you. Hmm. Screen lost. Okay. Okay. I have restarted my screen. So here were we. Okay. Now you are. I'm audible to all of you. Now you can listen to me. No. Yes. 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 Okay. Okay. Fine. Good. Okay. So we were discussing about the blood supply of kidney. So the name indicates the blood supply would be from the renal artery, and the renal artery is the direct branch of aorta. Okay. So the question which can come in exam, at which level the renal artery arises, and that's the level is L2. So I was telling you that in our first lecture we discussed our trunk surface anatomy, and there I told you that at which level aorta was bifurcated. Okay, so that was the level L4. Hello. I don't know. Okay, what is? Okay, now screen started again.
Ma'am, there is no voice in screen.
ओके सो अब आवाज आ रही है सबको और स्क्रीन भी शेयर हो रही है क्या प्रॉब्लम उसको बार बार हो रही है ऐसा यस ठीक है चलो ठीक हो गया So again, renal artery. Achha. We were discussing the important level of renal artery. So that was L2, and it gives these 5 branches, which are the segmental branches, enter the hilum, and then these segmental arteries, they divide into they give the lobar arteries, okay, one for each renal pyramid. So these will be the lobar arteries, and then this lobar arteries, they divide into the interlobar arteries. So these lobar are the interlobar, and then they form the globular, and then they end up into the afferent glomerular arterioles. Okay, so you just have to remember the name of these branches. So renal artery end up into the afferent glomerular arterioles. Now the venous drainage, you all know that the renal vein, okay, there was the renal artery was arising from aorta. So renal vein will be corresponding to the artery, and it will be going into the inferior vena cava. Okay, so again, the relation of hilum, you can remember like this: VAU, the vein would be anterior to the artery. Now the lymph drainage is very, very easy to remember. Lymph drainage, venous drainage would all be linked to the artery. So which artery they are draining? So here the renal artery goes to aorta. Okay, so all the lymphatic drainage from this kidney will be going to para-aortic lymph nodes. Okay, so that's very, very easy way to remember. If that is the main renal artery is a main branch of aorta, so it means all the lymph will be drained to the para-aortic lymph nodes around the origin of renal artery. Okay, so the nerve supply would be the sympathetic plexus. The afferent fibers would be traveling through the T10, 11, and 12 thoracic nerves. Okay, so this is the important venous drainage, lymph, and nerve supply. Now, a very, very important structure is the ureter. It comes in multiple exams, and they can ask you anything about ureter. The relations of ureter, everything is very important. So what are the ureters? These are the muscular tubes extend from the kidneys to the posterior surface of urinary bladder, and the urine is propelled along the ureter by peristaltic contractions of the muscle cord, assisted by the filtration pressure of the glomeruli. Now, what is the length of ureter? Approximately 10 inches, which would be the 25 centimeters long. Okay. Now, there are the 3 constrictions over the ureter. Now, what are the levels of these constrictions? Now, the first level is this pelvic-ureteric junction, where the ureter is joining the renal pelvis. And that is the renal pelvis structure. And here is the first constriction. Now, the second constriction is at the level of bifurcation of common aortic artery, or you can say at the level of pelvic brim. Okay, so second level is this, and the third level is when it pierces the bladder wall, means that is the intramural part. So these are the 3 constriction levels of ureter you have to remember. Now, this is a very, very important course of ureter that is coming in exam multiple times. Okay, so starting from the origin of ureter starts from the hilum of kidney. Now, it runs vertically downward behind the parietal peritoneum. Now, we all know that kidneys are retroperitoneal. Okay, so ureter would also be retroperitoneal. Okay, so it runs vertically downward behind the parietal peritoneum on the psoas muscle. Okay, psoas muscle is posterior abdominal wall. Okay, so now it enters the pelvis by crossing the bifurcation of common iliac artery. So this is the abdominal route, you can say. During abdominal route, the ureter just is going behind the parietal peritoneum, like retroperitoneally over the psoas muscle. Then it enters the pelvis, where it enters the pelvis by crossing the bifurcation of common iliac artery in front of sacroiliac joint. You can say this is the level of pelvic brim as well. Okay, if you see the pelvis where the sacroiliac joint So that would be a pelvic brim area, and here the ureter crosses the bifurcation of common iliac arteries. That is a very, very important relation of ureter. Now, after crossing this bifurcation, it runs downward, backward, in front, again in front, okay? It was in front of common iliac artery, now again it is in front of internal iliac artery and behind the ovary until it reaches the region of ischial spine. Now it goes to the spine level. It then turns forward and medially beneath the base of broad ligament where it is crossed by the uterine artery. Now the uterine artery is actually crossing the ureter. Okay, one mnemonic was during our exam that water runs under the bridge. At the level of uterine artery, we actually remember this. Water under the bridge. Water means you can say the urine. Okay, so ureter is under the bridge. So it is under the uterine artery. So uterine artery is crossing the ureter. Now what next? It passes 1.5 to 2 centimeter lateral to supravaginal cervix. Now this is also a very important exam question and very important relation or to the supravaginal cervix. It is just near 1.5 to just 2 centimeter lateral to supravaginal cervix, and then the ureter runs forward lateral to the fornix and it enters the bladder. Okay, so these are the very, very few important relations you have to remember. Relation of supravaginal cervix, then uterine artery relation, that it is crossed by the uterine artery, and ureter is crossing the common iliac bifurcation in front of internal iliac artery. So these are the artery relation with the ureter. If you see this diagram, this is actually only the pelvic root of ureter. So you can say here ureter is at the pelvic brim, and this yellow is the ureter. No? So it is going behind, and it is the going to the interior to the internal iliac artery, and then here, if you see this relation, this is the uterine artery. This is the uterine artery. So uterine artery is crossing the ureter. So this is the level of uterine artery, and here the ureter is going to the bladder. Okay, so here you can say that ureter is just 2 centimeters near to the cervix, very close to the cervix ureter. Okay, so ureter beneath the uterine artery. Yes, this is the uterine artery. Okay, so this is a very, very important relation of ureter. In previous 1-2 exam, they asked about the ureter relation. They actually give one time they gave the X-ray report of the sacroiliac joint. Like if you remember that if they have if they have given you the X-ray of sacroiliac joint, okay, and they can ask you, okay, what structure crosses this joint? Okay, so because at this joint place the bifurcation of common iliac artery, so ureter crosses this joint. Okay, so that's how they ask you in exam as well. So relations of ureter. Now again, they are the very important relations. Now the anterior, again the right ureter, left ureter, there will be a slight difference because of the intestines and abdominal organs. Now what would be the anterior, what would be the posterior? Now anteriorly, if you see arising from the kidney, so anteriorly would be the duodenum, the ileum, okay? The vessels would be right colic and ileocolic vessels, right testicular or ovarian vessels. So basically, uterine artery, we were discussing the uterine artery is also crossing the ureter. And here the testicular vessels, they're also crossing. So you can say ovarian vessels, you can say ovarian or testicular. So both these vessels, uterine and ovarian, they are crossing the ureter. They are anterior to the ureter. And then the root of mesentery of small intestine. So basically the small intestine relations are anterior to this right ureter. And again, the posterior would be the posterior abdominal wall. The right psoas muscle separates from the lumbar transverse process, and the bifurcation of right common iliac artery. Okay, so we discussed previously that the bifurcation of common iliac artery, it is crossing the ureter. Ureter is crossing this bifurcation. So posteriorly would be the bifurcation of common iliac artery. This is important, and anteriorly would be these testicular ovarian vessels. Okay. So again, if you see the left ureter, the organs would be cut, would be different. Like here was the duodenum and ileum, and here is the sigmoid colon, sigmoid mesocolon, and then the colic vessels, the left testicular ovarian vessels. Vessels would be remain the same. Then again, the posteriorly would be the same, the left psoas muscle and the bifurcation of left common iliac artery. Okay, so relations of ureter are very, very important. Okay, now the blood supply. So because the ureter is rising from the abdomen and goes till the pelvis, so it is having blood supply from multiple arteries. Like this is the, if you see the upper end, the middle portion, and the lower portion. So upper end would be this, okay, around the kidney. So it will be having the blood supply from renal artery. Okay, so and then the middle portion, if you see this, all this is the middle portion, and here what is going here? See the gonadal arteries, the testicular, the ovarian arteries, they are going, and this supply the middle portion of ureter. And also there are few branches directly from aorta as well. Okay, so the lower portion would be at the lower portion, the superior vesical artery. They are giving the branches to this ureter. So see, this is the superior vesical artery, and this is giving branches to this lower portion. Okay, so the arterial supply varies according to the area: upper end, middle portion, lower portion. Just remember, upper end, the kidney is near, so the renal artery. Middle portion, the genital organs will be near at the pelvic brim, so testicular ovarian artery. And the lower portion, you can say, because ureter it's ending to the bladder, so the arterial supply would be the bladder arterial supply, like superior vesical artery. Okay, so that's the way to remember. And venous drainage is corresponding veins, like renal artery here, then the upper end goes to renal vein, middle portion goes to testicular vein, lower portion goes to superior vesical vein. Okay, so again the same venous drainage. Lymphatic drainage, because all these arteries are from the aorta, so you can say the para-aortic lymph nodes. Okay, and the few branches also from the internal iliac artery, like this. So iliac lymph nodes are also the lymphatic drainage. Okay, para-aortic and iliac nodes. And then the nerve supply, you can say the renal, testicular, hypogastric plexus. So again, the area depends upward with the renal, then the testicular, then the hypogastric plexus. So efferent fibers travel with the sympathetic nerves and then to spinal cord. These are the segments of the efferent fibers. So that would be the L1 and L2. And the kidney was T10, 11, and 12. And so below the ureter would be the L1 and L2. We usually don't ask these segments in the exam, but arterial supply and very important blood supply of ureter. So move on. That was the end of ureter, and now move on to the suprarenal. This gland and left. Okay. Now, each cortex, with dark cortex, you all must have known what are the three types. There are three types of cells which are secreting mineralocorticoids, glucocorticoids, and the sex hormones. and the medulla would be secreting the epinephrine and norepinephrine. Okay. So there are the few important relation as well here. The right suprarenal gland. It is a pyramid shaped. It caps the upper pole of right kidney and it lies behind the right lobe of liver, because if the right side would be the liver. Okay, so it lies behind the liver and extends medially behind the inferior vena and it rests posteriorly on the diaphragm. So there will be difference because in the right side would be the liver and the left side would be the pancreas, the lesser sac and stomach. And again, it rests posteriorly on the diaphragm. So you just have to have a basic understanding of this relationship where this suprarenal gland is located. Okay, so if you just read these slides, you just don't need to remember it again. You just read this and have a basic understanding. Okay, so arterial supply now. Now, arterial supply is actually, there are the three arteries. Superior would be the inferior phrenic artery from the diaphragm, okay? And then direct branches from aorta. The suprarenal gland is collecting, and then the renal artery is also giving the branches to the adrenal gland. Now, there is no name, any specific name of suprarenal, like you can say the suprarenal artery. There is no direct name of the arteries. So they have the branches from the inferior phrenic, aorta, and renal artery. But in the venous drainage, you have the name of suprarenal vein. Now that's the difference here, the difference between the right and left. The right suprarenal vein, it goes to inferior vena cava. See, this is the right suprarenal vein and it goes directly to the inferior vena cava. Why it goes directly? You just have to remember like this, that because inferior vena cava is on the right side. We all have known that vein is on right side and aorta is on the left side, okay? So the vein would be going directly to the inferior vena cava, and the left suprarenal vein, it goes to the left renal vein. It cannot go up till the inferior renal vein, okay? So this is the difference for the right. Right goes to the inferior vena cava and left suprarenal goes to the left renal vein. Okay, so again the lymphatic drainage, because everything is from the aorta, so para-aortic lymph nodes, and the nerve supply because preganglionic sympathetic fibers from the splanchnic nerves. So the nerves will be ending in the middle of the gland, where they were secreting the epinephrine and norepinephrine. Okay, so that was all about the adrenal gland, and now moving to the urinary bladder. So bladder is also an important structure. It's a pelvic structure because the bladder is situated immediately behind the pubic bones within the pelvis. Okay, it has a strong muscular wall. It stores urine and it has a maximum capacity of about 500 ml. Now, this is a very important exam question as well, and we'll be discussing later on with the bladder storage and everything. At which volume the first void you get the first void of urine. So that is actually the 150 ml, and there are few pressures or also we will be discussing it later on in our next modules, not here. So just you can remember the maximum capacity of bladder is actually 500 to 600, you can say, okay, 500 to 600 ml, and first void you get the first void first at the 150 ml. Now the position. So bladder is actually a pelvic organ, and the position depends whether it is full or empty. So when it is empty, it lies completely within the lesser pelvis. Lesser pelvis, you all must have known the true pelvis is lesser pelvis, okay? But it rises into the abdominal cavity when filled or distended, okay? So empty bladder is pyramidal in shape. It has these parts: apex, base, neck, superior surface, and infralateral surfaces. If you see this diagram, if you see this diagram, this is the interior most part is the apex. Okay, and if you see this back, this is the base, or you can say this is the posterior surface. Okay, so anteriorly is the apex, posterior surface is called the base. Okay, and then this is the superior surface, the upper layer, and then you have these infrolateral surface, both surface, the right infrolateral and the left infrolateral. And then this structure is the neck. So this neck is present over the pelvic floor, over pelvic floor. Okay, so these are the few important important parts of bladder. And here the ureter is entering one side and the other side. Okay, so both ureters enter the bladder. See again the slide. What were the parts of bladder? Apex, base, neck, superior surface, infrolateral. Now apex. The apex of bladder, it points interiorly. So what is the interior? Anterior portion is the symphysis pubis. So it lies just behind the symphysis pubis, and it is connected to the umbilicus by the median umbilical ligament. So the median umbilical ligament, it is actually the remains of urethra. Now, the second part is the fundus, you can say base or posterior surface. So remember like this, anterior, and this is the posterior surface. So it is a triangular in outline, and it is related to the interior wall of vagina because it is behind this posterior surface. Okay, so it is covered in parietal peritoneum that has been reflected from the abdominal wall. The neck of bladder, it lies on the pelvic floor within the fascia that surrounds the urethra. Okay, so these are parts. Now again the few description. The supralateral angles joined by the ureters, and inferior angle give rise to the urethra. The previous we discussed that the base of the bladder like a triangle. So here these two supralateral angles, the ureter is going, okay, from one corner, other corner, the right ureter, you can say the left ureter is coming, and at the inferior angle, this angle, the urethra is arising. Okay, so this is like the triangular position of the base of bladder. And these ureteric orifices, they are approximately 2.5 centimeter apart. You can say these are the orifices, the 2.5 centimeter apart. Now the superior surface of bladder, it is not entirely covered in peritoneum because it has to be reflected to form a vesico-uterine pouch. Like if you can say this is the diagram, this is the apex, and so the peritoneum arises from the anterior abdominal wall. This is the superior surface. So it just covers the superior surface, and it just make a pouch with the uterus. Okay, so this is the vesicle because behind is the uterus. So this pouch would be called the vesico-uterine pouch. Okay, so it is reflected, it is not, so it is not entirely covered, and it makes a vesico-uterine pouch, and then behind the uterus it would be making a recto-uterine pouch of the peritoneum. Now the infralateral surfaces, which will be related to the retropubic pad of fat and pubic bones. And if you say that as a bladder fills, it becomes ovoid, and the superior surface, which was the upper surface, it bulges upward. So like we discussed that this is how the bladder, the apex, and this is the base and the superior surface. So when the bladder is surface go up, like, so the bladder is now ovoid. Okay, so so again there are few ligaments important uh, related to bladder. The pelvic fascia is a thickening condensation of fibrous tissue. They Why it's interrupted every time? Okay. The medial pubo-vesical ligament, the name indicates it goes from pubis to vesicle. I'm so sorry. I don't know if what problem is. Maybe internet connection. My internet is working. So much interruption in this lecture. Now you are viewing my screen. My screen is no. Again, I unended. इसको पता नहीं क्या मसला हो गया. Okay, so now let's finish this lecture. ये तो बहुत ज़्यादा काम कर रही है आज. अच्छा, so a very important structure of urinary bladder is a trigone. So where the trigone is present, it is on the posterior wall of bladder, okay, which is the trigone. So the trigone is derived from the fusion of distal ends of two ureters into the posterior wall of bladder. And how it look like? This trigone is like a triangle. Its mucous membrane is always smooth, even when the viscus is empty, okay, because the mucous membrane is firmly adherent to the underlying muscular coat. So the difference is that this mucous membrane is smooth, and rest of the bladder has the angle. They are the openings of ureters, and the inferior angle. This is the opening of the internal urethral orifice. So urethra is opening from this. So trigone means three sides like a triangle. Okay. These two angles, you can say the ureter opens into this, and then here the urethra opens from the inferior angle. Okay. So the muscular layer. So bladder is composed of the smooth muscle, and there are three layers of muscles. The outer would be the longitudinal, middle circular, and inner longitudinal layer. So the muscle layer is called the detrusor muscle. You will listen very frequently this detrusor muscle. Okay, so at the neck of bladder, this circular component, it is thickened. So this circular component, it thickens and it forms a sphincter-like action. So it is called sphincter vesicae. So this sphincter is the bladder sphincter. And the mucous membrane, discussed previously that inside the bladder, mucous membrane is loosely attached. So this allows the membrane to be thrown into folds when the bladder is contracted and to become smooth when it is distended. So when the bladder is empty, the mucous membrane is thrown into folds. Only the trigone is smooth every time. Okay. So this is very important. Blood supply, lymphatic drainage, nerve supply of bladder. The name indicates what is the bladder. You can say the vesicle. So the arterial supply, superior vesicle, inferior vesical artery. Now these two are the branches of internal iliac arteries. Now again the venous drainage, the name indicates vesicle, venous plexus. Okay, and it goes into the internal iliac vein because the artery is called internal iliac artery. So the vein is the internal iliac vein, and lymphatic drainage is the internal and external iliac nodes. You can say iliac nodes as well. And the nerve supply, because the organ is the abdominal organ, the inferior hypogastric plexus is the nerve supply. Okay, so this is the sympathetic and parasympathetic nervous innervation because detrusor muscle and they close the sphincter vesicae. Okay, so when the sympathetic system is activated, the micturition is inhibited, you can say, because the detrusor muscles are not contracted, they are inhibiting, and this sphincter vesicae, which is the this is a bladder and this at the neck is the sphincter vesicae. Okay, so this sphincter is also closed in the sympathetic innervation. Now what happens when the parasympathetic outflow, this is from S2, 3 and 4. What it does, parasympathetic actually first it stimulates this detrusor muscle. So detrusor muscles are contracted. Okay, so contraction of detrusor muscle and they inhibit the action of sphincter vesicae. So this sphincter it will be open. Okay, so then the micturition process start under the action of parasympathetic nerves. And the sensory nerve fibers, they enter the spinal cord at the above segments as well. So they are afferent and efferent nerves from the bladder. So this was about the micturition process as well. The sympathetic, what does sympathetic do on the bladder? And what does the parasympathetic do on the bladder? Now, a very brief introduction of urethra. Urethra is actually a 4 to 6 centimeter just in the females, but it is 25 centimeter long in the males. We discussed what was the previously we discussed 25 centimeter. It was the ureter. So in males, you can say ureter and urethra are equal in length, 25 centimeter each. Okay. So in males, there are three parts. First is a prostatic part around the between the then the membranous part, then the spongy part. Okay. So you don't need to go into the very detail of the male urethra. So from where it starts from the internal urethral orifice of bladder to the external urethral orifice, which is lying in the vestibule, immediately anterior to the opening of vagina. So numerous small mucus secreting glands, they open into the urethra and the epithelium. So urethral epithelium is important because what was the bladder epithelium? Bladder also has the will be same like the bladder transitional epithelium, and the distal portion, the distal level urethral epithelium non-keratinized stratified squamous nature. That now the lower part would be the stratified squamous epithelium. Upper part would be like the bladder transitional epithelium. Okay, so this was the epithelium of urethra. Okay, so it has internal longitudinal and then the external circular fibers as well. So the circular fibers at the proximal end, like the sphincter vesicae, we discussed previously at the bladder neck. This was the bladder neck sphincter, you can say, or sphincter vesicae. Okay, so we discussed that circular muscles, they were thickened to form this sphincter. Okay, so this was the internal, you can say, sphincter, and where those related to the external urethral orifice. So this is they form the sphincter urethrae. So external urethral sphincter is this. So blood supply to the urethra would be from the perineal branches of internal pudendal artery. You can say the internal pudendal perineal branches because urethra is a part of supplied by the internal pudendal artery. You just can remember this. So there are few branches of pudendal artery. So perineal branch is also a branch of internal pudendal artery. So urethra, you can remember like this. It is located in perineum, so it will be supplied by the internal pudendal artery. Now again, blood drains via similar venous branches like internal pudendal vein, and then the autonomic innervation via the pelvic plexus. Plexuses they usually do not ask in exam. Okay, so there are the few sphincters. So what was the internal sphincter? It was at the junction of urethra and bladder. Like this, we discussed that it is at the bladder neck. Okay, so this is the internal sphincter. It composed of smooth muscle because it is a continuation of bladder detrusor muscle. And under autonomic sympathetic control, we discussed previously that from the inferior hypogastric plexus, it would be contracted. Under sympathetic would be inhibiting this internal sphincter. So in males, it also prevents the retrograde flow of semen in the bladder during ejaculation. So during ejaculation, this sphincter would be closed. So retrograde flow would also be prevented through this sphincter. Okay, so in females, it is not anatomically distinct. Okay, so external sphincter. Now, external sphincter is lying here. It is located at the junction of urethra and bladder in females and after the prostate in males. Because in females, it is a very small structure, just 4 centimeter, and in male, it is 25 centimeter. So it's a very big part. So it is located after the prostate in males and composed of skeletal muscle. So skeletal muscle would be, you can say wherever there's written the skeletal muscle, it would be the voluntary control. You can control the action of this. And this would be because it is a smooth muscle, so it would be the involuntary. You cannot control this internal sphincter, but you can control this external sphincter. So it is under voluntary control via the perineal branch of pudendal nerve. Okay. So this was about the internal sphincter, external sphincter. That's the complete end of almost the urinary system. Okay. So now coming to the perineum portion, because we started in our previous lecture, the pelvis, the perineum. We started actually the pelvic diaphragm actually, and then the perineum was left. So what is the perineum? So perineum overlies the diamond-shaped inferior pelvic aperture. If you remember previous lecture, that this is the pelvic outlet. See, we told you that this was a diamond-shaped structure. Anteriorly, pubic symphysis. Laterally was the ischiopubic rami, tuberosities, the sacrotuberous ligament, and then this is COGS. Okay, so whole this structure, diamond-shaped, is called the pelvic outlet. And if you draw an arbitrary line between the ischial tuberosities, then you can say that anterior to this line is the urogenital triangle. Urogenital. Urogenital means the urinary tract structures and the genital openings. They would be present here. And posterior triangle would be called the anal triangle. The name indicates, so the anal opening would be present here. Okay. So you can say the perineum is divided into two structures. The anterior would be urogenital and the posterior would be anal triangle. Okay. So perineum actually it overlies this outlet, inferior pelvic aperture, pubic symphysis is anteriorly, COGS posteriorly, tuberosities are laterally. This region is divided into two triangles, arbitrary line through the ischial tuberosities. So the area anterior to this line is the urogenital triangle, posteriorly is called the anal triangle. Okay, so this is the basic perineum structure. Now, what is the urogenital diaphragm? Okay, now it's visible now. So, okay, so I was telling you the urogenital diaphragm. It is actually a muscular layer which is sandwiched between two layers of fascia. Okay, so what are the two muscles in the urogenital diaphragm? The first would be the urethral sphincter, and the second would be the deep transverse perineal muscles. Okay, so these are the two muscular layers which are present. So you can say this is the muscle, and upward is the superior fascia, and below is the inferior fascia. Now, what is this? The upper layer of fascia, it forms the superior fascia of your gentle diaphragm. You can say this is the superior fascia. Okay, superior fascia. In between, these are the muscles. Red is muscles, and then the lower layer of fascia. Lower layer fascia. Okay, inferior. You can say inferior fascia. So the inferior layer of fascia, it is called the perineal membrane. So this is an important landmark, that this layer, the inferior layer of the urogenital diaphragm, it is called the perineal membrane. And the space between the two layers of fascia, it is called the deep perineal pouch. Now this space is called the deep perineal pouch, and space below the perineal membrane. So this is the green is the perineal membrane, and below this would be called the superficial pouch. I'll discuss it in the diagram. See this. This is a very, very important diagram. If you see this structure, which I had drawn previously, urogenital diaphragm, you see urogenital diaphragm. So this whole structure you can say is the urogenital diaphragm. It includes two muscles, deep transverse perineal and sphincter urethra. Okay. So upward would be the superior fascia of this diaphragm. See this layer, superior fascia, and below the inferior layer would be the inferior fascia of this diaphragm. And this inferior fascia would be called the perineal membrane. Okay, so this is a very, very important structure. What is perineal membrane? It is actually the inferior fascia of urogenital diaphragm. Okay, so what is present between superior fascia and inferior fascia? So the space between these two facial layers, it would be called the deep perineal pouch. Okay, so what is below this perineal membrane? If you see this, this was the perineal membrane. Okay, so what space is this? What space? This is the superficial perineal pouch. Okay, you understand this? Any confusion here? Again, I can again I can it actually, okay, upward failure and okay, perineal and structure. So the space in this area, okay, you can see my screen now, right? Let's quickly do this session because I don't know, okay, what's the problem. आई थिंक ये जूम ऐप जो है ना वो अपडेट होने वाली है, इसलिए प्रॉब्लम कर रही है. Okay, so you understand these two pouches. Now I read what's written here. See the superficial perineal pouch, it is bounded below by the membranous layer of superficial fascia. See, this is the superficial fascia, facial layer. Just under the skin is the superficial fascia. And above by the urogenital diaphragm, or you can say the perineal membrane. Okay, so this structure is called the superficial perineal pouch, and the urogenital diaphragm, you can say this structure is the deep perineal pouch. Okay, so what are the contents of, you have to remember the boundaries of these pouches, what is up, what is above, what is below, and what are the contents. So the name indicates superficial perineal pouch. It would be having the superficial perineal muscles, transverse perineal muscles, the bulbospongiosus, the ischiocavernosus, the Bartholin glands, and the crura of clitoris. Okay, and the all muscles of the superficial perineal pouch, they would be supplied by the perineal branch of pudendal nerve. Okay, so if you see this diagram, pelvic diaphragm and coccygeus. So this is the pelvic diaphragm or pelvic floor. Okay, so this is the pelvic diaphragm, this is the urogenital diaphragm. So these two things are different. Okay, so next would be the deep perineal pouch. So it is bounded by perineal membrane and levator ani fascia. Okay, so this is the perineal membrane and the levator ani with the urogenital diaphragm as well. So urethra and vagina, both they pierce through this. Like you can say this is the deep pouch. So see, this vagina is going through this pouch, and urethra also goes through this here anteriorly. So urethral opening, you can say part of urethra, part of vagina, they goes through the deep perineal pouch, and then the external urethral sphincter, the deep transverse perineal muscles, bulbourethral glands, the internal pudendal vessels, and the dorsal nerve of clitoris. So these two vessels and nerves are also in the deep perineal pouch. Okay. So the perineal body, it is a very important structure. It's a fibromuscular node. It lies in the midline at the junction of anterior and posterior perineum. We discussed in the insertion of levator ani, the perineal body. Okay, so it is the point of attachment of many muscles. The external anal sphincter attached to this body, bulbospongiosus, transverse perineal muscles, both superficial and deep transverse perineal muscles, the levator ani as well. Okay, so the muscular attachments, they can ask you in exam which muscle has the insertion or origin over the perineal body. So you have to remember these muscles which attaches to the perineal body. Okay, so the posterior triangle, the name indicates it was the anal triangle. So it is a space between the ischial tuberosities and cogs, and it contains first the anus, because that was the anal triangle. It has the anal, the levator ani as well, and the ischiorectal fossa. Now this fossa is also very important structure in here. So the anus or the lower opening of anal canal, it lies and pretty good diagram. Okay. Okay. आई एम सो सॉरी कि आज है ना बहुत ज़्यादा इंटरप्शन हो गई हैं इसकी, इसको अपडेट करना पड़ना मुझे लगता है, ठीक हो जाएगा. Okay, so let's quickly just end up this perineum. So in the perineum, the anal canal portion is very important. So we will be discussing the rest of the GIT, the major just points, not you need to cover the whole abdominal organs, okay? Okay, so the inner canal is approximately 3-4 centimeter long, and they are thus surrounded by muscles which act as sphincters to it, like the external, internal anal sphincter, you all know. So there are few differences of this anal canal. In when we read the embryology portion, you will be knowing about the difference here in anatomy as well. Okay, so why the upper portion of anal canal is different than the lower portion of anal canal? Because they both structures are embryologically from different origin. Okay, so that's the reason the upper part is lined by columnar epithelium and it throws into these folds, and these are called the anal columns. Like this, anal canal is like has these anal columns. Okay, so the anal columns are characterized at the distal ends by having anal valves and anal sinuses and the nerve supply. So the nerve supply will be autonomic nerve supply. Okay, and the blood supply is superior rectal artery, because this upper part of anal canal, when we discuss the embryology, you can you will remember it very easily. Hindgut, so all the hindgut ओहो, ये तो बहुत ज्यादा आज प्रॉब्लम हो रही है. Hmm, आप सब लोगों को समझ आ रही है या इतनी इंटरप्शंस के बाद थोड़ा मुश्किल हो रहा है इसको करना? बताएं जरा. How much left? Actually, it's a just a last portion. I have to discuss what's the slide number? The anal canal. Just the 3-4 slides are left. 3-4 slides. Let's finish this. पता नहीं क्या हो रहा है, हालांकि इंटरनेट भी सही चल रहा है, मुझे नहीं समझ आ रही इसकी क्यों आज तंग कर रहा है. Okay, so quickly just end this session. So these are the blood supply, because it is a branch of inferior mesenteric artery, the superior rectal artery, then again the superior rectal vein, which is a tributary of inferior mesenteric vein, and the lymphatic would be the pararectal nodes. Okay, so this is the lower half, which is anatomically different, different. So that's why the lining is different. So upper half was columnar and the lower half is stratified squamous epithelium. Okay, and there are no anal columns here. Now the nerve supply is somatic. Here, there it was autonomic. So somatic was actually nerve supply is actually painful. They're sensitive to pain, temperature. Okay, so this is the inferior rectal nerve. It is also a branch of pudendal nerve. So everything in perineum is supplied by pudendal. And the arterial supply is the inferior rectal artery. Now, whose branch should be? It is a branch of internal pudendal artery, okay? So the venous drainage is the inferior rectal vein. It is also a tributary of internal pudendal vein and goes to the iliac vein. Lymphatic drains to the superficial inguinal lymph nodes. And the pectinate line, it marks actually the level where the upper half joins the lower half. So that's the fusion of these upper and lower half. It forms a pectinate line. Okay, so these are the sphincters, the internal inner sphincter and the external inner sphincter. So internal sphincter, it is formed by thickening of smooth muscle of circular coat, okay, at the upper end of canal. It surrounds the upper 3/4 of canal and its lower extremity is the white line. The white line is the transition point between internal and the subcutaneous part of external. Okay, so after internal, the internal sphincter is enclosed by striped muscle, voluntary external sphincter. So internal sphincter would be the involuntary and external anal sphincter would be the voluntary muscle. Okay, so if you see this diagram, the inner circular layer, it is actually forming the internal anal sphincter. See, this is the internal anal sphincter and external anal sphincter. It has three parts, 1, 2, and 3. So this is the deep part of external sphincter, then the superficial part, and then the subcutaneous part. Okay, this just go to the attach to the skin muscles. So external anal sphincter surrounds the lower part of anal canal. It overlaps the internal sphincter and is inserted into the skin at the lower end of canal, and has three parts: deep, superficial, and subcutaneous. Okay. So what are the importance of these sphincters? Because the in perineal tears during childbirth, so the tears are classified into 4 categories. It is very important tears. The first degree, when the injury is only to the perineal skin. Okay. So the second degree, the perineal muscles are involved, but anal sphincter is not involved. Okay. So only the perineal muscles like transversus perineal muscles, the bulbous spondylosus, they are involved, but not the anal sphincter. Okay, so that's why if they ask you what is the type of perineal tear in episiotomy, which actually you make episiotomy. So in episiotomy, we give the second degree perineal tear. Okay, and there not the anal sphincter is involved. Now, when the anal sphincter is involved, it goes higher degree, the third degree and the fourth degree. Now, in third degree, it involves a sphincter. Now, it has the subcategories 3A, B, and C. 3A means less than 50% of external anal sphincter. Now, outer is the external. Okay. So one by one, we are going to layer by layer. Like in first layer, we goes to the skin. Second degree, we goes to the muscles. Third degree, we goes to the sphincter. And sphincter, first is the external anal sphincter, less than 50%, 3B, more than 50%. Inner would be the internal. So both the external and internal are torn here. And what is the fourth degree? Fourth degree means all the damage to both the sphincter muscles and the anal epithelium. So mucosa involved in the fourth degree. Okay. So if you just quickly you can say first degree means skin, second degree means perineal muscles, third degree means sphincter. Both sphincters means 3A and B, they have the external anal sphincter, and 3C only internal anal sphincter. Not only internal, both the external, because external is outer. So external would be tear, then the internal would be torn. Okay. So internal sphincter would be tear in the 3C category, and in fourth degree, the anal epithelium as well. So previous everything is added, and the anal epithelium is also, it has breached. Okay, so this is a very important tears, types of tears. Now that was, I was discussing the ischiorectal fossa. It actually comes in exam, the relations as well. So it is a wedge-shaped space located on each side of anal canal. You see, this is an anal canal, and on each sides we have this ischiorectal fossa. Now, how it forms actually, if you see this is the base. So the base is formed by the skin. Okay, so it is the skin here. Now, these are the few walls. This is the lateral wall, you can say, and this is the medial wall. See, now what is the lateral? Lateral, I told you that this is an obturator internus muscle. Okay, so the lateral wall, it is formed by lower part of obturator internus muscle, and it's covering fascia. And what is the medial? See, medially, this is the levator ani, and here be the sloping and levator ani and the inner canal, you can say, or the sphincter muscles. Okay, base and edge, you can say this is the base and this is edge. So the edge is formed by both the medial and lateral walls. So inside this is the ischiorectal fossa. This is the base, lateral wall, and the medial wall. Okay, and very important structure inside, you see, what is this? It's a pudendal canal. We'll discuss it next slide. Now, contents of fossa, the very important contents. First, so ischiorectal fossa is filled with dense fat because it supports the canal and it allows to distend during defecation. And what's inside this fossa? It is actually the pudendal canal. And what's in the pudendal canal? The pudendal nerve and internal pudendal vessels. They are embedded in the facial canal. Canal, also called the MRCOG canal. Okay, so these are on the lateral wall of ischiorectal fossa on the medial side of the tuberosity. Okay, so the inferior rectal vessels and nerve, they also cross the fossa to reach the anal. So these are the contents of fossa and the boundaries of fossa. These two things are very, very important for exam as well. Now, just a brief one slide on these pudendal nerve and pudendal vessels. Okay, so because the perineum is every organ, every structure in perineum is supplied by the pudendal nerve. So pudendal nerve is a branch of sacral plexus. It leaves the main pelvic cavity through the greater sciatic foramen, and we discussed in our last lecture that pudendal nerve, it goes through the both sciatic foramina, the greater and the lesser sciatic foramina. Okay, so it leaves the pelvis through the greater sciatic foramina, and after a brief course in gluteal region, it re-enters the perineum through the lesser sciatic foramina. Okay, and then after and by means of its branches, it supplies the external anal sphincter, muscles, and skin of the perineum. Okay, so this is just a brief course of pudendal nerve. And then the branches, these are the three major branches of perineal. So the inferior rectal nerve is this nerve runs medially across the ischiorectal fossa and supplies the external anal sphincter, the mucous membrane of lower half of the canal. We discussed it previously. Clitoris, it is distributed to the penis or clitoris, and then the perineal nerve. Okay, so this perineal nerve, it supplies the muscles in the urogenital and the skin on posterior surface of the scrotum or labia majora, you can say. Okay, so these are the three branches of pudendal nerve, and they supply, through these branches, they supply all the perineum. Now the sphincter muscle actually is supplied by this inferior rectal nerve, external only, not internal. And the muscles in urogenital triangle, they are supplied by the perineal branch of pudendal nerve. Okay, so now the internal pudendal artery, it also has same course. See, this is the internal pudendal artery, it is going through the greater sciatic foramina and then goes back to the lesser sciatic foramina. Okay, so this is, it gives branches again, inferior rectal artery, like pudendal nerve gave inferior rectal nerve. So inferior rectal artery, the perineal artery, and then the few perforators as well. So internal pudendal artery is a branch of internal iliac artery, and it passes from pelvis again, the same route, greater sciatic foramina, lesser sciatic foramen, and the branches inferior rectal artery, like the inferior rectal nerve in the pudendal. Okay, so inferior rectal nerve was also supplying the lower half of anal canal, so here as well, inferior rectal artery. Okay, then there are the perineal artery. So they are the, it also, this perineal artery give branches, multiple labial branches as well, the deep artery of clitoris, the dorsal artery of clitoris as well. Okay, so I quickly go through all the perineum structures. So that's, I think, the end of this lecture. So any question up till now, if you have any question, you just slide show नहीं हो रही, ये पहली बात है. अभी तो स्लाइड शो हो रही है ना, ठीक है. अच्छा, कोई क्वेश्चन किसी का? जल्दी जल्दी खत्म किया. अच्छा, कुछ क्वेश्चंस हैं, अगर इसका कोई आंसर दे तो. क्वेश्चन 1 is which structure forms the lateral wall of ischiorectal fossa? This is the levator ani, coccygeus, obstructed internus, or external anal sphincter. Great. So the inferior rectal vein, it drains into obturator vein, inferior vesical vein, internal pudendal, or internal iliac vein.
Internal
Pudendal, very good. And this is the relation of hilum of kidney. So renal vein is what structure to the renal artery? Anterior, posterior, superior, medial, or lateral? V.
posterior.
Renal vein is according to artery.
Vein is anterior to artery.
Anterior, yes. Renal vein, anterior, then artery, and then ureter. Okay. So this is interior. So renal vein is anterior to. ये तो मैंने सिर्फ एक fill in the blanks type लिखा है ना. So renal vein is anterior to renal artery. Okay. Okay, what is the maximum capacity of urinary bladder? 200, 300, 400, and 500? 500. Yes, 500. So यही क्वेश्चन है. थोड़े से ब्रीफ क्वेश्चंस बस डाल लेते हैं. अच्छा, कोई क्वेश्चन अभी किसी ने कुछ पूछना हो, कुछ समझ ना आया हो? वेरी इंपॉर्टेंट टॉपिक्स विद टू मच डिस्टॉर्शन. हाँ, डिस्टॉर्शन तो आज वाकई बहुत ज्यादा हो गया. अच्छा, अगर इसमें कुछ भी मिसिंग हुआ या कुछ भी, तो मुझे आप लोग वीडियो में बता दीजिएगा रिकॉर्डिंग में, क्योंकि रिकॉर्डिंग वैसे तो कंटिन्यू ही थी, लेकिन कहीं ना कहीं कुछ प्रॉब्लम्स हुई हैं. तो अगर कुछ भी प्रॉब्लम हुआ तो वो हम दोबारा डिस्कस कर लेंगे, कोई प्रॉब्लम नहीं है. और वैसे भी ये स्लाइड्स भी आपको शेयर कर देंगे, ठीक है. थैंक यू वेरी मच मोमना. सो दैट वाज द एंड ऑफ आवर लेक्चर. ओके, और कुछ भी और प्रॉब्लम हो तो आप लोग मुझे पूछ सकते हैं. नेक्स्ट वी विल बी डिस्कसिंग और जेनिटल ऑर्गन्स. ओके, सो जरा थोड़ा सा हैप्पैजार्डस में लिखा होता है हर बुक में, तो इसको जरा थोड़ा सा तरतीब से कराना पड़ता है, ठीक है. सो इसलिए ना मैंने पेरिनियम को इधर रखा, पैल्विक स्ट्रक्चर्स और इनके साथ, ठीक है. सो लेट्स एंड और रिकॉर्डिंग एंड स्टॉप.